This is Hold My Stethoscope.
Hey everyone, welcome
Hey.
back to Hold My Stethoscope. So, grab your stethoscope and listen in because today we're taking you into one of the most critical and often misunderstood emergencies we face in nursing, sepsis.
Yes, this isn't just textbook definition. We're sharing real stories from the bedside, those moments where recognizing sepsis quickly meant the difference between life and death.
So, this episode is going to be a little bit different. We're going to do kind of a little bit of mix of clinical insights, personal reflections of things that we've seen and done, and a little bit more continuing with our faith-based encouragement that you've seen in the last two episodes. So, this
Yes,
first segment, we're going to talk about sepsis and go a little bit more in depth. So,
yes.
we've faced many different as ER nurses, face many different patient scenarios that have come in where patients have been deathly ill. I feel like there's been at least the last one I feel like I took care of was this, older, elderly female from a nursing home who was incontinent and just had
Hmm.
ended up having terrible urinary tract infection. Patients come in, their blood pressures are in the absolute toilet. They are heart rate super high. And it's really important that we follow the Propsis Surviving Sepsis campaign. And they talk about one of the things they talk about is the calf mnemonic. So that basically stands for C is for cultures, A is for antibiotics, L is for your lactate, and F is for fluids. Kind of those four main things when you identify sepsis. So it's really important to be able to know the signs and symptoms, such as your patient's heart rate. Initially, or it's going to be high blood pressure, though, in your first kind of stages of shock and stages of sepsis, there can be normal or even a little slightly hypertensive. But you start seeing a little bit of restlessness, agitation, anxiety, and the patient may start getting a little bit confused. They're having a little bit less perfusion. So these are things to look out for. And then the calf mnemonic is kind of helping towards treatment. So making sure that we're drawing blood cultures before we start antibiotics, that we start antibiotics within the first hour. We're giving and measuring lactate. We're not giving, but measuring lactate levels to kind of track that acidotic state that they're in, as well as giving fluids. And the recommended fluid dosing is for adult patients is 30 mLs per kilo to help really flush the bacteria and all of that stuff out of the system. I'm sure, Felicia, you've seen and dealt with many sepsis patients as well in your
Absolutely.
time.
Absolutely. And one of the greatest challenges in managing sepsis is that it often begins quietly. You have to know that. It can be vague or non-specific type symptoms, and that can easily be overlooked. So a patient may not initially present with dramatic instability, but sometimes they have those subtle clues, that demand a more careful or trained eye to recognize, okay, this patient could possibly be septic. So that's very important. Knowing things like they could have mental health changes. Their mental status changes. Sorry about that, not mental health. Mental status changes can also occur. Like Brittney was saying, like their heart rate could be elevated. They could have a low grade fever, or they could have fast breathing, which is tachypnea. So, those changes could be also attributed to anxiety, pain, or other, routine conditions. So you just having that trained eye does help to say, you know what, I think this patient may be septic, and it's just better for us to do something about it than to not. Making sure those lab values, looking at things, and even their skin, but with the lab values, as Brittney said, their WBCs being like elevated, or their lactate actually being elevated, and even their creatinine that requires a trend of recognition rather than just single data points or whatever. So watching out for those things. Their skin, That can also be another thing. Is it modeling? Are their extremities cool,
Mhm.
to touch, or delayed, or with capillary refills? Is a cap refill delayed? Those are things to look at. So, there are challenges that lie differently in the early signs from like countless other conditions that we often may not be sure if it's sepsis or whatever it is, but we want to make sure that we get on it the sooner the better.
Yeah.
So that's kind of really my take when it comes to sepsis, which is this is Sepsis September, everybody, meaning that we need to definitely always be aware. But, this is that month that we really take that time to focus on
Yeah.
sepsis and knowing those signs and symptoms. So, absolutely.
I think all of what you said obviously is very truthful and correct. One of the things, though, is really want to emphasize what she had said about early recognition. The best thing that you can do from being a nurse and being that perspective is recognizing those early signs and symptoms and doing something about that. Early
Absolutely.
recognition saves lives. That's not just
Lives.
something you hear, it's actually the truth. The
It's the truth.
quicker that you can recognize that somebody's heading in a bad direction, the quicker you could intervene, which will then ultimately have better outcomes for your patients, which is why we're all doing this, is because we want to help people. So
With that being said,
the other thing I wanted to mention though is, sometimes it's pretty obvious, like, the last patient I was talking about that was uroseptic, right? That
mm-hmm,
she came in with very obvious signs and symptoms of sepsis, but I will tell you, and Felicia again can say this, we have to also put away biases that we may have, especially in the ER, because we can have very young patients come in, and this includes pediatric patients that come in that are septic. Like, we have to be very mindful that just because you're young and healthy doesn't mean that sepsis will preclude you. I had at one point,
absolutely.
this was several years ago, like a 25-year-old that came in, had the flu, but was septic from that viral infection that ended up spreading into pneumonia. So do
Absolutely.
not negate the fact that you can have young patients that have those signs and symptoms. And like she said, just
Absolutely.
to reiterate, they can be very subtle where you're like, what's going on, right? You don't maybe know, but one of the things like you have to kind of look at as a nurse is trusting your gut instinct.
Thank
Like,
you. Gut feeling.
I feel like you just know, especially the longer you do this, the more you just know when something isn't right. Even if you don't know what it is, if you know something isn't right, that's
Right.
probably right. That's like
No,
100% correct.
absolutely.
So
Absolutely 100%. I agree.
yeah,
It's
so it's
true.
really important to trust your gut. If something it doesn't feel right, it's probably not. So keep trusting it. Advocate for your patients because sometimes, you're the one that's spending the time with the patients. You're the one in the rooms with
Absolutely.
patients. You can also see if there's a subtle sign. This is more probably for an inpatient, who's continuously seeing their patients. You can notice those little changes where your patient
Absolutely.
like this morning, they ate their breakfast, they were doing okay, and then by lunchtime, they're starting to just be off, and you're just like, "That's not right." So trust your gut and, like, look at those little signs and symptoms.
I mean, nobody's ever gonna look at you like, "Well, what do you" and even if they do, you still advocate for your patient. Like,
Absolutely.
stand strong for your patient because you're the one there with them. You're seeing those changes and you wanna act on it. Don't ever feel like, "I can't." Another thing is when it comes to sepsis, it does require teamwork. It's very, very important
Absolutely.
that we have teamwork with this because there's a lot going on. And what we have to understand as nurses, I know at times we feel like we know more. However, it is very important that these patients get the fluids that they need. I know we go on our tangents about this is too much fluid for this person. They're going to end up in overload. I'm telling you that the statistics show that it's very important that we give those fluids because what we're doing. We think we're helping, we're hurting when you don't. So it's important to just know that this is why it is weight based and everything. It's better to do it and for us to get the fluid back off than to not give the fluid. So please, please remember that. And with teamwork, we can make it all happen, getting those cultures, getting that lactic, getting all that, getting that urine, getting everything that we need. And just like Brittany said, trust in our gut. That's really what it's about. Trusting that gut and following through.
And like I said, I think we said in one of the previous episodes, like, teamwork makes the dream work. Like, that is the truth.
And
In
that's the
nursing, there is
mhm,
nothing I think probably more crucial than working as a team because nobody can do
absolutely.
everything, nobody can know everything, and
No,
nobody is, like, the most skilled at something, but as a
no,
team, you can move mountains. You can. If you work together, you can really, really make a difference in these patients' lives. So,
yes,
thank you for bringing that up, Felicia, because it's
yes. So that is
so
our
important.
moment of grabbing that stethoscope and listening in.
Love
Sepsis.
it, girl.
Yes.
I
Grab that
love
stethoscope and listen in.
listen yeah, listen
Yes.
in.
Yep.
So in moments like these when seconds count, I think we both learned in our careers that sometimes there are things just bigger than us. We've
Yes.
talked a lot about, especially in the episodes about Felicia's journey with her pancreatic cancer, how much faith has played a role in her positivity, has played a role in helping her with her disease, and has just played a role really in both of our lives, just in
Right.
general. And
Absolutely.
how really, like, it has made us better people leaning into
Yes.
our faith. So
Yes.
I just do think it's important to kind of bring that up and touch on that. I will tell you, probably early in my career, and I think this is good. And I always say this to people, there's always a healthy level of fear that you should have taking care of patients. Like, if you're
Right.
truly in this for the right reasons and you truly get into nursing to help people, there should be a little bit of healthy fear in going into
Absolutely.
work every day, because you really can be a lifeline between life and death for somebody. So it's really important to be able to, you know, do this career
Mhm.
that you've chosen to do with a little bit of fear, because that makes you better. It makes you stronger as a nurse because you know that there's something to lose. I also feel
Absolutely.
like as my faith, with in Jesus Christ and God has grown over these last couple of years, it's really helped me to be even more grounded. I feel
Yes.
like as an ER nurse, I was kind of taught how to remain calm. It took a little bit of time because, your first couple episodes of like high
Mhm.
stress and patients crashing and all this stuff, like your adrenaline goes, right? You get that fight or flight. But as you see it more, you become more comfortable in that chaos, and you almost kind of become a little bit more grounded. And then I feel
Absolutely.
like adding in that faith element that, God is with me through all of this has continued to keep me grounded, knowing that, really things are in his control. And I am going to
Absolutely.
be here to do my best, to live out his mission. And he's in control. And I am here as his servant to do what I can on this earthly side.
And I feel exactly the same way. My faith has definitely come even stronger with what I'm dealing with at this current time with this
Absolutely.
pancreatic cancer. God is always going to be there with me, no matter who else is not. And me realizing that, and making my faith even stronger. He's the one person that I can always talk to that's never going to judge me, always going to be there for me. And that what I had to learn was to trust, in him that he would continue to guide me. None of this is in my control, none of it. And realizing that as long as I have my faith, then I can remain positive. Don't get me wrong. I want you to know I have days where I sometimes feel like I'm circling the drain. And it happens. It's normal.
You're a
But
human being.
overall, Absolutely. But my faith and support and friends and all the love that I get along this journey, the army that I have is really what makes me feel so blessed. So I need you to know that the journey with this illness, definitely my faith is what is getting me through it. Each and every day, I am finding hope and courage when everything just feels so overwhelming. I have to say in the moment, you know what? This is God's will. This is not in my control. And I'm going to give you an example. Last week, I was supposed to have a very important appointment in my eyes, the main reason why I was headed to New York. And it was a pretty busy day, which then delayed the most important appointment to me. So I was pretty upset that when I was on my way to see that doctor, they called me and said, "We're canceling your appointment. We will, the clinic is closed." I was beyond devastation. You have no idea. I was like, why is this happening to me? Very upset. And then it clicked. I said, "What are you doing? This is happening for a reason. God doesn't want you to talk to this doctor today. You need to wait to see because you don't know if it's better news for you by the time you talk to him," which they then set the appointment for Tuesday. And let me just tell you, I am so grateful that I waited because that conversation with that doctor was one of the best conversations I've had. Truly gave me hope. And that was because of my trust in God and not trying to take it in my own hands. And because my plan was, well, I'm going to see that doctor tomorrow. He's going to see me face to face. I came here for
Yeah.
that. But you know what? Never did I make it there. Oh, no. I was set up for a procedure. It was in the same building. They called me and they said, "Mrs. Gainey, we have an opening. Can you come earlier?" It was almost like they knew I was going to talk to that doctor. Like I was going in there to say something, but it wasn't for me to do. And I'm glad I didn't do it and that I was stopped in my tracks, told this is where you need to be, and it all just worked out. So sometimes I know our faith is questioned, but we have to trust. And that's me. I feel like I have to trust in God that He is continuing to guide me.
Yeah, I feel like, we're in a we're definitely not gonna be bringing politics or
Mm,
anything into this, but we're in a very, like, rough time in our world just in general right now, and lots of things have been happening the last couple weeks, which I feel like once again has really anchored me even more to my faith,
yes,
knowing that it is not just part of my personal life, but also something I'm taking into my career
absolutely.
because you're constantly facing, especially as a ER nurse, like life and death situations. And the more that we can cling to our Lord, knowing, like you said, that it really is in his control and whatever is going to happen in our lives is going to happen. It's just a really powerful like thing to feel in your heart.
And
So
just know that
I hope anybody out there, is listening that maybe this resonates with you. Maybe, it
yes,
helps you to connect with your own faith. And that doesn't have to be the same faith me and Felicia
it's
have, but just
no,
connecting with your faith and knowing that, you've got someone, whoever that may be, in your corner for you throughout all the struggles that nursing brings, because it is a
absolutely.
field that will test you time and time again. You
Absolutely.
see humanity at their worst,
Yep,
and it really makes you question. I think sometimes, like, when you're going through personal struggles, but also when you're going through professional struggles, it really like tests your faith. And I hope this
absolutely.
just gives people the courage and the strength to continue to be anchored in your faith and knowing that, there's somebody out there and we hold strong to that faith.
That's right. That is it. Yep.
So I just wanted to kind of go back as well. We're going to talk about in just a minute here some takeaways that we found as our lessons for nursing. But I did want to just take a moment. We dropped our episodes actually yesterday. So you're going to be hearing this in
Yes.
a couple weeks, but I'm very excited that we had dropped our episodes. I realized though when we did it, when we were kind of introducing ourselves, like we didn't do the best job of it. So
No.
I just wanted to take a moment to kind of like really introduce myself and Felicia and tell you a little bit
Yes.
more of our history and our background. So my name is Brittany. Hi guys.
Hi, Brittany.
I am originally was born and raised in upstate New York. I originally got right into nursing school like right when I graduated. So I became a nurse at the RN at the age of 20. And then I had about 2.5 to 3 years of med surge tele experience. I went to the floor right out of nursing school. Within 7 months, became the charge nurse of that floor on night shift.
Mhm.
That's a rough transition being in your first year. I still to this day don't understand why I did that, but whatever. I mean, it ended up
It
working out for
happens.
me. And I always knew though, like wanted to go into critical care, whether that was the ER or ICU. And I originally thought it was going to be ICU, but the Lord knew that that wasn't the right choice for me and the ER was the route. So that's the way I went. Haven't looked back, haven't regretted it since then. Did a little over 2-ish years in a ER in upstate New York, and then I started travel nursing, and I did that for a little over 3 years before I 3 years, 4 years, something along those lines before I settled down here in Florida, where we're based in Florida. And then I took a staff job here at the healthcare system I'm currently with and worked staff down here for 2 more years before I transitioned into the nurse educator role. So I have been majority of my career has been in ER nursing, with a couple of years in med surge tele, and I will tell you for anybody who's looking to transition, it is a rough transition. So give yourself grace because being a ER nurse is literally complete, like legitimately 180-degree turn from being a med surge nurse. You have to completely like do away with your other thinking. So just a little bit more brief, about me and my background. And now I want to get a little more into Felicia's background about her medical
Okay.
history.
So I'm Felicia, everybody. And my background's a little different. I actually, when I went to college, I never wanted to be a nurse. I'm going to be honest. Never wanted to be a nurse. Honestly, I wanted to be an FBI agent. I know that's
Love
weird.
that.
It was really what I wanted to do. I'm born and raised in Virginia. So coming here to Florida, it was like, well, what seems to be the demand? And then I needed to get a job. And I was like, "Well, looks like nursing is what the way to go." So I actually went to school something quick. I went after getting my bachelor's degrees. I have two, one in criminal justice and one in behavior science. And then because I was going to be that FBI agent, remember? But then that was not what it was going to be. I thought that's what it
She
was
is
going to
one,
be.
just not like
I
in a
I sort of
complete
am undercover, but
capacity.
don't you know what? I got you if you need me, guys. I got you. I can find out anything you need to know. So instead, I decided to go in that nursing route, something I never saw myself. I went to school, got my LPN. First, I was a unit secretary on the floor at one of the hospitals in the healthcare system that we still currently work for. So I did that while I was in school for my LPN. Got my LPN within a year. Within a couple years after that, I got my RN. I've always been, even as an LPN, in an ER setting. I started it even though I was at our one organization, I decided that I was going to go to another organization. And I did that for about a good 6 to 8 months. And then I said, this is probably not for me. And ended up back at the organization that I currently still work for, which has been my home for over 23 years. As an ER nurse, I've had the most amazing experience. And even as an LPN, I know things are different now, but at that time, your LPNs were the ones that had the experience. There weren't a whole lot of us in there. There were probably about 6 of us in there. We was running things, honey. Like we did traumas and everything. And then as organizations decide they want to go in another direction, things change. But By that time, I had decided to go back to school, get my RN. I was actually working night shift, and I did that until I got my RN, and then I went back and flipped back to day shift. And I've had an amazing career, and I've learned so much in that environment that actually allowed me to go outside of the emergency room while still in the emergency room. I literally worked in endoscopy, their like PACU side, and then I went into plastic surgery. 8.5 years while still continuing to work as an emergency room nurse. By far one of the most amazing jobs as well. I've learned so much between the both of those jobs. I'm very grateful for my career. You just have to understand how amazing your body is and how it lets you know when there's something wrong with it. You just got to listen to it. You gotta adhere to it, and you need to follow through with it, and don't just always think that it's gonna go away. Now, I'm not saying make everyday visits to the emergency room. I wanna make that clear. That's not what we want, but I want you in tune with your body enough to say, "Hey, something's not right," like I did. "Something's not right here. I think I better get it checked out." So I want to make that clear. It's important that you get things checked out. It's not important to be abusive about it. So that is what I need you to know. From there, I continued my ER career up into 2.5. Well, actually, I think I'm on that 3-year mark of deciding to go into education. I never thought that I would,
Nice.
but I've transitioned into education and I have learned a lot, and it continues to allow me to still be a part of that emergency room setting. But I'm also a part of that whole critical care setting. You have the emergency room, I have the ICU, and it just has given me an even bigger picture as an educator, and I do love that, and I feel respected in that position, and I'm very grateful for it. So, that is a little about my background. That's me.
Yeah,
I am married with kids.
I'm glad we, got a little bit more history of the 2 of us so you know who's you're actually
That's
talking
right.
to. Yeah, we're both now in the ER education space, and I'm just so excited that we still get to see patients, help out when we can, and also kind of help and inspire, the next generation with our
Absolutely.
knowledge that we've gained throughout our years of experience. And it's been really fun. I feel like I definitely found my niche when I transitioned to this job because I mean, I love taking care of patients, but it's been really a fun last almost
It
7 years
has.
for me, which is crazy to be like inspiring the next generation. And I love being able to teach. I feel like it's just been really, really fun. So
It is great to teach, and I love it when they're eager to learn. Like, that's fulfilling for me.
it is. I
If
agree.
we have people that are like, "Oh my god," like, they ask questions, they're not afraid, because we always want you to never be afraid to ask when you're unsure and not just do, because you have to remember that we're dealing with people's lives. This is very, very important. Always trust your instincts. Let me
Yep.
tell you, never ignore those changes that we see in vitals or your patient's mentation. Never ignore those things. "Oh, I think she or he is okay." You know what?
Yep.
Trust your instinct. This is why you have them, and follow through. Never ever ignore any type of subtle changes that you see, especially when it comes to healthcare. You want to communicate clearly with providers, even if you're on the floor as a med surge or ICU nurse as well. We want to reach out to those providers, no matter how upset sometimes they may seem. You have to advocate for your patient. That is what you're supposed to do. So never feel like, "I don't want to call this person," because you need to remember that this could be a loved one of yours and you would want someone to do the same for you. So to me, that's very, very important that
Yeah.
you take that away from nursing.
That reminds me, kind of speaking of all of these things, like when I was a brand new baby nurse within my first 6 months of being on the floor, I worked night
Mhm,
shift. Um, Majority of my career was spent on night shift. And I just remember being like, they kind of told me during orientation, like, this is a doctor. He doesn't like to be disturbed at night. So don't call him for anything. So I'm only a few months off of my orientation. And I had this patient, and I forgot what she was there for, like, this was obviously, like, 20 years ago. I forgot what she was there, but I do remember the story because she started having, not really as much difficulty breathing, but her oxygen saturations kept dropping. And she just was like, "I'm just not feeling the best." And so I was like, "Okay, like, I'll just keep monitoring you." And then her oxygen kept dropping. And I was like, "Okay, let's put on 2 liters." And like, "Okay, let's bump you up to 4 liters." And then,
oh,
I just kept
wow.
doing it. And I was like, do I call the doctor? Do I not? Like, she's having hypoxia, like this and that. And I feel like I was the one, looking back now, I'm like, obviously, like, what were you doing? But in
Mhm.
that moment, I remember, and it still sticks with me to this day, 20 years later,
Look at
that
that.
I
Yeah,
should have called the doctor way earlier than I did, because this patient ended up being on day shift when they came in, and kind of, I called the doctor at 6 a.m. or whatever.
right.
They ended up starting, I kind of started that process, but like they ended up transferring her to ICU because she had massive PEs. So like
Wow.
I literally, to this day, I will not ever forget that, because those are the stories sometimes that stick with you the most. Luckily, that patient didn't have poor outcome. Like, she was able to get to the ICU and eventually got discharged and everything
Absolutely.
like that. But like there was changes. Like, she had changes that I recognized, but I didn't do anything about it for hours. Like,
Because they
that
were saying to you,
haunts me.
doctor doesn't like to be called. And
Yeah,
those are the things that I need for nurses out there to no, that's not okay. If we ever feel in our gut very strongly that something's not right, and I think I need to make a call, no matter what anybody's saying, make the call.
make the call.
Make the call,
Yep.
okay? Because you can save that person's life. Follow your gut. This is why you have those instincts. They're not just there to be just giggly, like, maybe. No, they're there because you feel that something's not right. And I want you to follow through with that. If you take nothing else away from this,
Mhm.
please advocate for your patients. And when you don't feel right about something, I don't care how dumb anybody else thinks it is, do it. Better
Yeah.
to do it than not to do it and find out that it's something that could have been prevented had you gone ahead and just done it. So, and we all make those mistakes in our career. I personally had one myself. I'll never forget a patient coming in and she had had chest pain. And I knew we needed to put an IV and stuff, but they were like, give some sublingual nitro. Well, in my mind, you take it at home anyway. Let me go ahead and pop one under your tongue. Wrong, honey. Crash cart, here we come. And it was that lesson that I learned all those years ago and will never, I don't care if you take a bottle of them at home. If you come in a medical or emergency setting and I'm there, you get an IV because I will never ever take that chance on dealing with your blood pressure dropping and not having that IV access. But that's where your teamwork comes in because when we noticed this crashing, we were all in, right? Now she got not one IV, she got two, and things got turned around. But you learn from those things that you weren't sure about at the time in your career, and you never do it again. And that's
I
life.
think that's really important too, because as like newer nurses coming into this profession, like, I mean, we're human beings. At the end of the day, we're
Yes, we
human
are.
beings. Are flawed people. Like, that is
Yes,
how God made us. We are flawed. And the best thing that you can do, like Felicia said, is like trust your gut, trust your
yeah,
instinct. Like, I wish both of us probably have
yes,
many other stories that we can look back
yes,
on and being like, I
yes,
wish I did something different in that instance.
yes.
And while, like, my patient and I'm assuming your patient both had
The
good
outcome,
outcomes, they
right.
could have been
But
worse. They
They could
could
have
have
been a
been
lot
bad.
worse.
And
It's important, yeah,
best thing that you can also learn is to learn from your mistakes. Like, mistakes
absolutely,
are the things that I keep with me throughout my nursing career. Those
absolutely.
are the things that continue with me, not necessarily the wins I had. It is the mistakes I
It's the
made. They
mistakes.
will never
Amen.
happen again. I can tell
Never
you that
again.
to this day, they will never happen again.
They won't, and and we do want every nurse to take that away from this.
Yeah.
Mistakes are gonna happen. We know we're human, you know, it's not that we ever intentionally do anything. We sometimes it's just sort of like, well, maybe things are gonna turn around, or maybe or not thinking that something's gonna get worse. But when your gut is telling you to do something, you gotta follow through. And that's really what's important here, that
Yeah,
we
and I
do that
think,
as nurses.
also, especially now, and when me and Felicia first started out, information sharing wasn't like it is now. So you
No,
weren't able to kind of, I guess, consume information from outside sources other
right.
than, what you heard from your preceptors or other things in the hospital
No,
or
no.
but now you have so much information out there that, even like listening to this right now, maybe you're like, oh, like, okay. And you're kind of connecting the dots. So, the more information that you have, not just your personal stories, but other things you
Yes,
hear can help you to, gain extra knowledge to further you in your career and make you
absolutely.
not just a good nurse, but a great
But
nurse.
a great nurse and a trustworthy nurse,
Yep.
because to us, I'd rather you say, I don't know,
Hmm.
and ask someone or look things up. There's so much information out there for us to be able to look at. Talk to your providers, talk to your charge nurses, talk to your superiors, but not everybody knows everything. That's very important for us all to know, that nobody knows everything. So it's okay that you research and seek resources to find those, whatever those questions are. There are like things set in stone in organizations for you to be able to look at, maybe for about a skill that you are like really not sure about 100%. So maybe you need to read up on that skill a little bit. That's fine. Do just that. You don't need to take the words of, but you have to remember everybody's background is different. So maybe somebody's telling you something a preceptor told them may not be all of what it is. Okay. It's okay that you take that extra step and reach out or look it up or go into whatever resources your organization has to make sure that you're doing the right thing by your patients, because that's what's important. And as someone that is a patient, has been a patient in the past, I want to be able to trust the people that are caring for me. And I know you do too. So
I
let's
do. It
keep that.
actually brings me back to, as we were talking about sepsis and like stories like this, it brought me back because it was funny. Felicia had just transitioned to the educator role. And so she was kind of training with me. And I got a call one day while I was at work from my dad, that my mom was in the ER. And, I was like, what's going on there? He was like, she's been having headaches. Her back's really bothering her, like all of this stuff. And I was like, this is so weird. Like, what's going on? And especially my family still lives in upstate New York, being so far away. It's, you have to, once again, as the nurse, you're like, what's going on as a nurse, but then you're a patient or a patient's family member and you have to rely on those others to take care of them. That can be really hard.
Yes.
We'll come to find out, like, they initially thought she had like an ear infection, I think is what they ended up diagnosing her with. And I was just like, that doesn't make sense. Like,
Right.
even still, like the nurse brain as well as the daughter
Right.
brain was also like, this doesn't make sense. None of this makes sense. Like, what do you mean? Like, I don't understand. And then I was calling and trying to talk to the nurse, but the nurse was busy with my mom. Well, come to find out, they ended up calling a stroke alert on her because she got very, very confused. And then she also started having what they thought it wasn't like seizures, but she was starting to like have rigors.
Mm-hmm.
So they called a stroke alert just to kind of expedite things and make it look out. And I was like, guys, this doesn't make sense. None of this is making sense to me. I was like, "Have you got a urine on her yet?" And they're like, "No." And I was like, please straight Catherine get a urine on her. And I was like, and this sounds like she's got a fever. Like this is where the shakes and all of that stuff's coming from. So I was like, check a temperature, check a rectal
Right,
temp on her. So
right.
they ended up doing a rectal temp. She had a huge fever. They ended up straight cathing her, huge raging UTI, which they actually ended up finding out after this. They did more investigation into the UTI. Her she had chronic back pain. She has chronic back pain, but she had, a massive kidney stone that was blocking and
Oh,
became infected her ureter. So she was, like, in full-blown sepsis because of
see?
this.
Mhm.
So, it's crazy, like, knowing, obviously, what I know, the knowledge I have as being a nurse, like, I was advocating for my mom, obviously, but, like, advocating for your patients where you're like, "That doesn't make sense. Like, what you're
Right,
telling me is what you
right.
think is going on doesn't make sense." And
Absolutely.
she's doing great. Like, that was a very scary time in my life, being far away, ended up flying hip and all that stuff. She spent, overnight in the ICU. She was on pressers, like the whole thing. It was a really
Yeah,
like scary portion being the on the other side of healthcare. But she ended up, getting a stent and having the IV antibiotics, and she's had some issues since then, but she's doing really well right now. But it just kind
great.
of puts into focus, like, this can happen to anybody anybody you love.
Absolutely.
Sepsis affects millions and millions and millions of people a year. So really important, like, we've been focusing on sepsis, but in general, like, just trust your gut. If something doesn't
Yes.
make sense, say something. Like,
Say something.
trust your gut,
Yep.
work as a team, and just remember that if you are a great nurse, you would want, like, your family members to be taken care of like that by somebody, like Felicia said, that you trust is doing the best thing for your family member, that's gonna be
Right.
taking care of your mom, your dad, your brother, your sister, your husband, your wife, whoever it is, to the best of their ability, and they're doing things properly. So, if that's what you want for your family member, you have to be that nurse for
You
others.
have to. You absolutely do, you know? And
Yeah.
remember that we're all educators,
Truth.
all of us. So
Truth.
continue to educate others and don't hold all the knowledge just for yourself. We need to share. And there are things that people know from experience, and it's okay to listen to that and receive it. And because you just never know what you could learn from somebody. And, it really is important for us to just reflect on how fragile and valuable life really is. Because I can tell you firsthand, you know,
Yeah.
life is very, 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 very special to me. And I look at life completely different now. I'm just here to let you know. I do. You can change. This is my personal belief at this time. If it is something that you can change, don't let it stress you. Change. Make the change. There are things that we can't necessarily make those changes right away. But with my faith, I know that change is coming. So that's just a little bit of my advice to everybody. Don't freak out about things that you can change. And that was something that I had to learn. And because of what I'm going through, is how I learned it. And everybody's different, and I get that. But for me, this is definitely something I have taken from that. So
Oh, I love
hope
that.
you enjoy that. Yeah.
Yeah,
I
because
want to make sure.
sometimes dropping the stethoscope means letting go of the weight we carry after
Yeah.
something bad happens. Sometimes we see things that are not normal for people. And I think sometimes we forget about that. Like, I was literally driving home today after work, and I was just thinking to myself, like, how normal all of this stuff is. Like, I feel like if somebody told me anything in the world right now about a patient, about something, I wouldn't be surprised at all. Like, but
Uh-huh.
that's not normal. Like, I could tell my brother who's not in healthcare or something, and he'd be like, "Oh my god, what? No."
My
You know,
husband too. Yes,
And it's like, oh, like, sometimes I think we forget that, like,
we do.
things that we see and do are not normal for people out there in the
No,
world, which is why this is a good platform for nurses to be able to come and hear this stuff because it can be hard to try to deal with non-medical people who don't understand. And this stuff is hard. The things that you see every day, just the amount of stress that is put on your life for
absolutely.
choosing a career of helping somebody, it's not easy. And I hope that you all take that time to recognize that and then also know that dropping the stethoscope sometimes is okay because sometimes you need your own USA moment.
I have to drop the stethoscope when I'm getting my care, when I'm getting care for cancer. Listen, that's not my specialty. I am the patient. I know my role. I've had
Mhm.
some amazing nurses take care of me, and I'm very grateful for each and every one of them and continuing to be cared for. So, have those moments where you drop that stethoscope and you're being that outside of that healthcare everyday type of thing. I remember going in the grocery store and just frowning as I would look at people and it was because you always would bring things home with you. But being able to separate it and have fun and just enjoy life and like we say, drop that stethoscope. That's what it's about for us, and this is what keeps us going each and every day when we got to pick back up and grab that stethoscope again. So, just so you know, catch sepsis early, everybody. That is truly what saves lives. Very
Yeah.
important to us.
So, once again, we really hope that you enjoyed listening to us. If you did, please remember to, on whatever platform that you're listening to us, remember to like, share this podcast with others who
Please.
need that, little moment of, clarity or
Uncertainty. Yeah,
reflection or whatever they
whatever.
need. Make sure to leave us any comments. We want to hear from you.
Yes,
We also want to build like a community, like of nurses who have each
absolutely.
other and support. So please like, share, subscribe to us. Don't miss any episodes that we have when
None.
they're releasing. We're so excited to be able to do this. It's a lot of fun for
Absolutely.
us, and we really hope that we can bring something valuable to your life. So
Absolutely. Absolutely.
sometimes drop the stethoscope, and then sometimes you remember you have to have, somebody else holding the stethoscope for you while you put on your big girl pants and do your job. So,
Absolutely, everybody. Absolutely. So together, we all got this. All
yeah,
right.
we love you guys.
We love you
Thank you
guys.
so much. We'll see you
Thank you.
next week on Hold My Stethoscope.
Hold my stethoscope.
Bye.
Bye.